360 environment scan. Please introduce yourself.
My name is Dustin Fasistol and I consent to this recording.
Alright, so now I'm gonna perform hand hygiene. Knock, knock, knock. Provide patient privacy. Hello, my name is Carl. I'll be your nurse for today. I will be conducting a respiratory and cardiac assessment, which includes inspecting and listening to your heart and lungs from the front and back of your chest. Some areas of your chest will need to be exposed during this assessment, but I will provide a towel to provide privacy. This assessment will take about 15 to 20 minutes. Do I have your consent to proceed?
Yes.
Perfect. So before we get started, I have a few questions. What is your full name?
My full name is Dustin Fasistol.
Okay, what name do you prefer to be called with?
Dustin.
Okay, what is your date of birth
July 20th, 1998.
and your age?
27.
Okay, what gender do you identify with?
Male.
What languages do you speak?
English and Tagalog.
What is your relationship status?
Single.
Single. What is your occupation?
Sales manager.
Okay, so now at this point, I'm going to check the patient's armband, identifying the patient's full name, Dustin Fasistol, date of birth July 20, 1998. So I have the right patient and the MRN. Okay, so what brings you to the hospital today?
I'm having difficulty breathing.
Okay, have you had any cough or sputum production?
Yes.
Okay, is it dry?
Dry cough. Yeah.
Okay, all right. No, non-productive.
No.
Okay. Um, have you experienced any fever or chills or weakness?
No.
No. How are you feeling generally overall?
I'm okay.
You're okay. And any past medical history?
Yes, hypertension.
Are you currently taking any medication?
Yes, Tylenol.
Tylenol. Do you have any allergies to medication, food, or environment?
No.
Okay, so I noted that the patient is sitting upright, appears comfortable, and no visible signs of distress. Skin tone appears appropriate to patient's ethnicity. Okay, so going back to your cough, are you a smoker?
Yes.
Okay, how many cigarettes per day?
2 cigarettes per day.
How many years have you been smoking?
5 years.
5 years. And if you're, have you ever thought of quitting smoking?
Yes, I have.
Okay, if you're interested, I can provide some information about the Smokers Helpline before you leave today.
Okay.
All right. Are you currently experiencing shortness of breath or difficulty breathing?
Yes.
Okay. Does anything makes your breathing worse during activity, exertion, exercise, or lying down?
Yes, during exercise.
Does anything make it better?
Yes, while at rest.
How would you describe the difficulty breathing?
Catching my breath.
Okay. Do you feel the difficulty in a specific area of your chest?
Yes, mid-chest.
Mid-chest. On a scale of 0 to 10, 0 being no difficulty and 10 being worse difficulty, how would you rate it?
7.
When did it start?
4 days ago.
Is it constant or intermittent?
Intermittent.
Do you have any idea what might be causing the difficulty breathing?
No.
Okay. I know you mentioned earlier that you don't have a fever, but I would like to check your vital signs, so your blood pressure, temperature, and your oxygen level. Is that okay?
Okay.
Okay, perfect. So I'm going to check your blood pressure. Sorry. Okay. Gonna start. Now I'm gonna put this oxygen probe on your finger. Okay, so while waiting, I'm gonna check your temperature as well. Open your mouth, close. Okay. Now open. Awesome. Okay, so temperature is 36.8 orally, which is normal. While I'm still waiting for the blood pressure reading, I'm gonna check for your pulse rate. So I'm checking it on the radial pulse. For 1 full minute, I'm just looking at the clock right in front of me. Okay, perfect. So heart rate is about 88 on a regular rhythm, which is normal. Oxygen is about 97% on room air, which is also normal. Blood pressure is 136 over 85, slightly elevated than normal, but because you have history of hypertension, that is within the normal range, okay? All right, so I'm gonna take this off. Now I'm gonna ask you to put your arms across your chest, just like so, and I'm gonna check your respiration rate. Okay, pretend I have my clock in front of me and I'm gonna check it for 1 full minute. Just breathe normally. Okay, so 1 minute has passed, so respiration rate is about 18 on a regular rhythm. So now at this point, I'm gonna begin my respiratory assessment. Just gonna put this on the side. I'm just gonna ask if you could just face this way on your back. Okay, face okay, and then if you could just take off your shirt. Great, perfect. Now I'm gonna put this on your chest to provide privacy. All right, so now at this point, I'm doing my inspection. So posterior thorax is symmetrical with symmetrical chest expansion. No thorax deformities or masses. Spinous process in a straight line. Um, no skin discoloration. Anterior to posterior transverse diameter is 1 to 2, which is a normal finding. Now I'm gonna feel for your back. Okay, so temperature is warm to touch, equal bilaterally. Now I'm gonna palpate your back. Let me know if you feel any pain. Any pain?
No.
No pain, no moisture, no deformity or masses or crepitus noted. So now I'm gonna put my hand on your back, and if you feel my hand, please say the word 99.
99, 99, 99, 99, 99, 99.
Okay, so I felt equal tactile fremitus on the posterior thorax. Now I'm gonna do my auscultation using the bell of my, the diaphragm of my stethoscope. Okay, I'm gonna warm up my stethoscope, and if you feel my stethoscope, take a deep breath in and out. Deep breath in and out. 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 So good air entry equal bilaterally. Bronchovesicular sounds are heard on the upper lobes close to vertebrae, although there is a mild wheezing sound heard on the lower bilateral lobes during expiration. These are abnormal findings, but because you're a smoker, these are the usual findings, okay? Now if you could just face front, please. Perfect, so now we're gonna put the towel on your back. I'm gonna do my inspection now on the anterior thorax. So the anterior thorax is symmetrical. Anterior thorax, downward sloping ribs, okay. Trachea and sternum midline, costal angle 90 degrees, consistent skin color throughout the anterior thorax, no skin discoloration. All right, so now I'm gonna feel for your chest this time. Okay, so temperature is warm to touch, equal bilaterally. Now I'm gonna palpate your chest. Let me know if you feel any pain. Any pain?
No.
No pain, no moisture, no deformity or crepitus, and no masses noted. So now I'm gonna put my hand on your chest again. If you feel my hand, please say the word 99.
99, 99, 99, 99, 99, 99.
Okay, so I felt equal tactile fremitus on the anterior thorax bilaterally. So now I'm gonna auscultate, so listen on your lungs. So same thing. If you feel my stethoscope, please take a deep breath in. I'm gonna warm it up. Breathe in and out. 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 Okay. In and out. In and out. In and out. Sorry. In and out. Alright, so good air entry equal bilaterally. Bronchovesicular sounds are heard on the upper lobes closer to the sternum, although there is also a mild wheezing sound on the lower bilateral lobes during expiration. Again, these are abnormal findings, but because you are a smoker, these are the usual findings. Okay, so now just a few more questions, Mr. Pasistol. Are you currently experiencing any chest pain or discomfort?
Yes.
Okay, does anything makes it worse during exercise, exertion, or activity?
During exercise.
Okay, does anything make it better?
Yes, while at rest.
Okay, how would you describe the pain?
Catching my breath?
Okay, no chest tightness or stabbing or sharp pain?
No.
No, okay. Do you feel the pain on a specific area of your chest?
Yes, mid chest.
Mid chest. On a scale of 0 to 10, 0 being no pain at all and 10 being worse, how would you rate it?
7.
Okay, when did it start?
4 days ago.
Okay, is it constant or intermittent?
Intermittent.
Do you have any ideas what might be causing the pain?
No.
No. Okay, so now at this point, I'm gonna do my cardiac assessment. So I'm gonna ask you to tilt your head this way, and I'm gonna shine the light. So lift up a little bit. Okay, I'm gonna shine a light right here. I'm assessing for the jugular vein. You can relax now. So the left external jugular vein is flat with no distension. So now I'm gonna assess for the carotid artery. So now I'm just gonna palpate. Okay, I'm gonna do the same thing on the other side. So 2 plus carotid pulsation equal bilaterally with smooth contour with quick upstroke and gradual downstroke. So now I'm gonna auscultate the carotid artery using the bell of my stethoscope. I'm gonna ask you to take deep breath in and out and hold it. And if you feel dizzy at any point, just breathe. Okay, so I'm just gonna warm up. Okay, deep breath in and out and hold. Okay, breathe normally. Now I'm gonna do the same thing on the other side. Take a deep breath in and out and hold. Okay, I felt no bruit equal bilaterally. Okay, you can breathe normally now. So now at this point, I'm gonna do my cardiac assessment on the cardiac valve. So now I'm gonna locate using the diaphragm of my stethoscope on the right second intercostal space for the aortic valve. Okay, so now I'm locating the second left intercostal space for the pulmonic valve. Okay, so now I'm locating the Erb's point on the third left intercostal space. So now I'm locating for the tricuspid valve on in between fourth and fifth left intercostal space. Okay, so now I'm locating the mitral valve on the fifth left intercostal space mid-clavicular line. Okay, so all cardiac valves are heard, including Erb's point, with clear S1 and S2. No split sounds, no murmurs. So now I'm gonna do the same assessment, but this time I'm gonna use the bell of my stethoscope. I'm gonna warm up. I'm gonna locate again for the right second intercostal space for the aortic valve. Okay, so now I'm locating for the pulmonic valve on the left second intercostal space. Now I'm locating for the Erb's point at the third left intercostal space. Now I'm locating for the tricuspid valve on the in between fourth and fifth left intercostal space. And now I'm locating for the mitral valve on the fifth left intercostal space mid-clavicular line. Okay, so all cardiac valves, including Erb's point, are heard with clear S1 and S2, no split sounds, no murmurs. Okay, so now I'm gonna do my peripheral assessment by checking the brachial artery. Can I see your arm, please? Thank you. So I'm locating for the brachial artery and the radial artery. Okay, I'm gonna do the same thing on the other side, locating for the brachial and the radial artery. Okay, so I felt 2 plus on the brachial and radial artery pulsation, which is normal, and they're all regular rhythm. So now I'm gonna check for the nail beds. Can I see your hand and your fingers, please? So nail beds are pinkish in color. Now I'm assessing for the capillary refill on all fingers, on all digits. I'm sorry. So capillary refill are all less than 2 seconds, which are normal findings. So now no signs of cyanosis. If you could just put your 2 thumbs together like so. Okay, perfect. Now your fingers together like so. Okay, perfect. So no signs of finger clubbing. Now, Mr. Fasistal, do you have any questions for me?
No.
Okay, so this concludes our cardiac and respiratory assessment. I will now let the doctor know about my findings of my assessment, and I will come back with a copy of the Smokers Helpline as we discussed earlier. Okay?
Okay.
Thank you for your time, and I will be back.
Thank you.